We are seeing metabolic conditions surge globally. Polycystic ovary syndrome diagnoses are climbing, and in places like India, nearly 18% of people with prediabetes progress to full type 2 diabetes every single year. Western medicine typically treats these conditions as completely separate issues. A doctor might prescribe a pill to lower blood sugar or address an ovarian cyst with localized surgery, treating each symptom in a vacuum. Ayurveda approaches human biology differently. In this framework, the body has no isolated parts. It operates as a vast, highly interconnected network of biological channels. These channels are called Srotas. For women, the Artava-vaha Srotas serve as the dedicated physical and energetic pathways responsible for carrying reproductive materials. The engine powering these pathways is your Agni, or metabolic fire. When modern stressors, processed diets, and irregular sleep diminish this fire, digestion slows. Without strong metabolic fire, waste stagnates, creating a dense, toxic buildup that chokes the reproductive channels. That systemic blockage is the root malfunction. Whether it eventually surfaces as an ovarian cyst or insulin resistance, the underlying cause is a suffocated network. You cannot permanently fix the localized symptom as long as that root architecture remains blocked. To reverse a systemic blockage, you have to actively dismantle it. Ayurvedic texts call this clinical process Samprapti Vigatana, which translates directly to breaking the pathogenesis. The first phase of this dismantling is deep biological purification. Clinically, this is known as Panchakarma, a strict set of therapies designed to forcefully expel toxic stagnation from the tissues. For pre-diabetic patients dealing with heavy metabolic dysfunction, doctors utilize a specific purgation therapy called Virechana, which actively pulls accumulated waste out through the digestive tract. This bar chart shows patient data before and after Virechana therapy. Fasting serum insulin and HOMA-IR levels, a key metric used to measure insulin resistance, drop significantly, proving the body is physically regaining its sensitivity to insulin. To address imbalances from the top down, the protocol pairs this with Panchakarma. This involves administering targeted herbal oils directly into the nasal cavity. The nasal passage offers a direct route to the brain. The medicinal oils travel via the olfactory nerve to communicate directly with the hypothalamus and the pituitary glands, which act as the control center for the body's hormonal output. These methods forcefully clear the biological channels, resetting the communication between the brain and the metabolic system. This structural clearing restores hormonal homeostasis, allowing the body to return to its baseline state of balance. By clearing the pathways first, the body is finally prepped to absorb targeted reparative medicine. Once the channels are clear, the protocol moves to phase 2, deploying specific botanicals to repair damaged tissue and correct physical abnormalities. Recent clinical trials have verified the therapeutic impact of a botanical called Asparagus racemosus, also known as shatavari, on the female reproductive system. Shatavarins act as selective estrogen receptor modulators. Because their chemical structure mimics estrogen, they combine to specific receptors in reproductive tissues, either stimulating or inhibiting hormonal activity based on the current metabolic state of that tissue. In patients diagnosed with PCOS, this targeted modulation physically repairs damaged ovarian morphology and restores the proper balance of androgens in the bloodstream. The protocol also integrates other specialized botanicals, specifically fever nut and an herbal formulation known as Kanchanar guggulu. These specific plants have a highly targeted mechanism of action. They actively block the body from converting androgens into estrogens. This process effectively starves large fluid-filled ovarian cysts, causing them to physically shrink. These botanicals act as precise biological architects. Once the toxic blockages are removed, herbal medicine operates as a targeted tool, capable of altering the physical structure of a disease, rebuilding the body's natural function from the inside out. When this systemic approach is completed, large cysts regress naturally, pre-diabetic lipid profiles stabilize, and normal, healthy ovulatory rhythms return. Ayurveda defines health as the unobstructed flow of materials through the system. A clear internal network is the primary requirement for sustained vitality. Maintaining that systemic purity long-term doesn't require constant, heavy clinical intervention. The ultimate preventative medicine lies in daily and seasonal routines, known as dinacharya and ritucharya. By avoiding irregular, highly processed diets and aligning our patterns of sleeping, eating, and physical activity with the natural rhythms of the day and the changing seasons, we protect our metabolic fire. Syncing our routines with the external world ensures our metabolic engine burns bright. It keeps biological channels clear, allowing the body to function as designed.